Welcome to the Brilliant Board Review Podcast, your trusted source for high-yield board prep, CME, and the latest in clinical medicine.
Now, let's talk about pain reduction using methotrexate in osteoarthritis. And you're like, what? That doesn't make sense. Well, I know your textbook tells you otherwise, but osteoarthritis has an inflammatory component. This has been noted for years. The textbooks haven't caught up. And it's a chronic pain that reduces quality of life. I don't know if you've had a loved one, patients, somebody down the street, whatever, yourself is, if you're not moving and you're just kind of stuck and it causes you to have pain to move, just think about your quality of life. Think about just doing basic things, grocery shopping. Maybe you like hiking and you can't hike anymore. Maybe you want to do just simple things, going up the stairs in your house, and the pain is so much that you cannot do these things. So this is a study. It's a multi-center, randomized, double-blinded, placebo-controlled trial. Nice. This is in the UK, and it's between June 2014 and August 2017. And the patients had to have radiographic osteoarthritis and knee pain within the last 3 months with inadequate knee pain for at least 3 months and inadequate response to current medication. They were given methotrexate once weekly, and it was started at 10 and titrated up to 25 milligram dose versus placebo. And there was significant reduction in pain in the scores, in the pain scores. So this may be something we're looking at, because when you're treating osteoarthritis, what are you going to give? Usually the patients are older. You can't bang away NSAIDs on them because your GI bleeds and the side effects of the NSAIDs, kidney failure, and those kind of things. You also, acetaminophen has been proven to be worthless for osteoarthritis. And then what are you going to use? Opioids, and then you have the side effects of opioids. So this may be an answer. Now, methotrexate is not perfect. Remember, this is a chemotherapy medication. In fact, it's one of the first chemotherapy medications. So GIs get nausea and vomiting about 20 to 65% of the patients. Mouth ulcers and sores. People get headaches, fatigue, and you call this methotrexate fog. Is they kind of feel blah the day after taking one of those pills. And you go blah, blah. So what can you do to help? Folic acid, 1 milligram daily, or you can do 5 milligrams once a week. Folic acid is cheap. Methotrexate is cheap. Now, liver damage. Now, this can be anything from fibrosis to liver, but more than likely it's just elevation in liver tests, and this can happen anywhere from 15 to 50% of the patients. Now, there is can have inflammation and fibrosis of the lungs. In fact, whenever somebody comes into a pulmonary clinic and there's fibrosis, if they look for methotrexate, they're going to blame it on that right away. They also can have drops in the WBCs and platelets in a patient. So this is maybe a start to look at of what we can do differently for osteoarthritis, because right now our treatments suck, our medical treatments suck, and getting a knee replacement sometimes is not a viable option in patients because it's a pretty rough surgery to come back from. The orthopods do a great job of putting those knees in. It's the recovery and the risk of clots, both DVTs and PEs, in that recovery process. So there's a lot of things that we need to do to get better at knee osteoarthritis. Maybe this is a start.
Thanks for listening. Visit brilliantcourses.com to learn more and claim credits for this educational activity. See you next time.